Dr. Patwell, it's good to see you again.
Good morning.
I really appreciate you inviting us over to the new center here. In fact, I'm so impressed of what Sutter North is doing to this community with the new facilities. They sure are investing a lot of time and effort, money, and personnel into the community.
Yes, Sutter's shown great faith in us, providing us with this building.
Now, Dr. Patwell, you've been involved for a long time in emergency care, urgent care, medical care. Could you tell our viewers a little about your background and maybe where you went to school and what you did first?
Yeah, I trained in medicine at UCLA down Los Angeles, and I did my residency in family practice at Sacramento Davis campus.
Oh, the university there, great.
Yes.
And then how did you end up coming out to Marysville, Yuba City?
Well, back in 1988, I came up and moonlighted a few days for Dr. Donaldson, and I liked it so much, and they had an opening that I accepted it, and I've been here ever since.
Now, that was primarily with the urgent care part of Sutter, or was that?
Yes. It's always been urgent care. I've been in the urgent care department for the last 12 years.
Well, all the residents of the Yuba City, Marysville area are aware of driving down Plymouth Street and seeing the urgent care sign next to Fremont. What's the history of how long that went on there?
Well, that clinic's been open approximately 20 years. It was started by some doctors who that later sold it to Marysville Medical Group, and then later became a part of Sutter North Medical Group. Last year alone, we saw 24,000 visits.
To a lot of people in the community, there's confusion about urgent care versus emergency care. Maybe you could help clear that up for our viewers.
Yes, urgent care is different. Urgent care, we can address most issues that people have. If they have a fractured bone, if they have a laceration, if they have infections, bronchitis, pneumonias, abdominal pain, we can take care of it. But we can't do some things urgent cares do. We cannot take care of a heart attack as far as giving certain medications that are required, stroke care, things that are a little more serious, things that are more life-threatening, need to be taken care of at an emergency room.
So you would advise if someone thinks they're having a heart attack or someone in their family thinks they're having a heart attack to go to the emergency room and ride out rather than come to urgent care?
Yeah, right? Crushing chest pain in an older person who smokes should possibly consider going to the ER first.
What are the typical things that you'd see on a daily basis in urgent care?
We see lots of bronchitis, bladder infections, abdominal pain, lots of injuries, broken bones, lacerations, children with ear infections are typical visits.
Now, this new building, to me, is extremely impressive. It doesn't feel like Yuba City, Marysville anymore. It feels like big city USA here. And it's spacious, beautiful architecture. It just is more comfortable than most facilities. What do you have here? Maybe you could summarize that, then we'll take a look at the facility.
This building combines 4 departments. We have our urgent care occupational medicine. It's open all the time. But right next door we have our new radiology wing for the Sutter North Group with the latest technology and CAT scanners and MRIs. Upstairs we have our cardiology department and our orthopedics and the laboratory. So combined in one easy place for access. So
some of these things have been moved from the previous urgent care facility and some have been moved from the Marysville facility, and they've all sort of focused right here.
Yes.
Well, maybe we could go over there and take a look.
Okay, I'd be glad to show it to you.
Great, thanks. So we're entering now the reception area?
Yes, the waiting room for urgent care.
And it seems so much bigger than the facility on Plymouth Street. How many seats do you have here?
Approximately 30. It's about triple the size of our old waiting room and decorated much nicer.
Sure is.
Much more comfortable.
So people will come in the door and then they check in right here?
Check in urgent care desk and then off to the back.
And that's that way, so let's take a look at it.
Okay,
great.
Let's go.
Good. So we're immediately inside the reception area, and I see a lot of people busy working. What's happening in here?
This is the registration area where people get placed into the computer and charts are made.
And then there's medical record storage somewhere here too?
Yeah, right over here.
Okay, good. And then so patients come in, and then maybe you could show me now where is the actual examination facility?
Right down this hallway.
And let's go down there. Good. So how many examination rooms do you have here?
We have 10 exam rooms and 2 procedure rooms. A typical exam room being the table and procedures equipment for a typical office visit.
Comfortably arranged and decorated, so it feels pretty comfortable, nice in there. So,
yes.
So then they must have cases where people have to come in for bigger procedures, so maybe you could show me your treatment procedure rooms too?
Sure. Procedure room right down here.
Oh. Now these doors are unique. I've never seen them quite like this. What do you call this?
Well, these are breakaway doors when we need to bring ambulance gurneys in here. These doors, you can open them, and then you can also swing them open
Oh, you
for bigger access.
surprised me on that. That is
Yes.
great. So this looks more like a room where you could do, you know, big procedures, quick, big examination. Now, I guess there has to be areas for the dreaded paperwork. I really like the way that you have this doctor workstation set up. It's spacious. It looks like you have room for, you know, 3, 4 doctors to be working at the same time. But what are we looking at there?
Well, this is a patient's foot and ankle x-ray, and it's in the small view now, but I can magnify that pretty simply.
Well, go ahead, show us what you would do.
Okay. You can increase the size. Now you're seeing just the big toe.
Well, you
here.
can certainly find fractures and
Right.
things like that.
And you can put a magnifying glass on it and go right up the edge and look at all the edges of the bone and make sure a fracture is not missed.
Oh, beautiful.
And the radiologist and the orthopedist can also look at these films in their station at the same time.
Now, you also have on the other side over here an occupational health
Yes.
center. Can
Yeah.
we check that out too?
Sure. Right
Let's
down
do
here.
that. Great. So we've now gone through the doctor's station, and we're in another complete set of examination rooms and
Right.
offices, and
Yes.
this is called.
Occupational medicine.
Now that's entirely separate from urgent care, right?
It's the other half of the department is the occupational health aspect, yes.
But in terms of patients, they wouldn't come into urgent care and be
No.
in occupational health, so it's
No.
sort of separated that way.
Separate waiting room, separate registration desk, and a whole set of office visits for that day.
Well, a lot of people don't even know what occupational health means, so this is a good opportunity for you to tell us all about that. What is the occupational health service?
Both sides. It's pre-employment, so before someone's hired, pre-employment physicals, drug screens, and testing, as well as after they're hired, doing work comp, work injuries, work care follow-up.
Great. Well, I know you've also set up today a chance for us to go over and see the radiology department.
Yes,
So
yes, and
direct
it's
us,
nice.
direct us
Yes.
that way.
Okay.
Which way do we go?
We're down here.
Okay.
Back office, line 1, back office.
That's straight over here.
This way?
Yeah, now we're entering the radiology department, and this is Michael Burke, our imaging manager.
Hey, do, Dr. Peppercorn.
Mr. Burke, it's great to see you again.
Yeah, it's been about 14 years, I guess, since we did a program together.
I'm going to thank Dr. Patwell, though, because
Sure.
he's going to have to take off to see some patients. In
Thank
fact, I
you.
heard you paged.
Thank you.
But thanks again for showing
Okay.
us everything. Great. And we did work years ago, back in the 80s.
Oh.
You showed us things over at Rideout. And
We had, yeah, that's when we started our catheterization program in
Cardiac
heart
cath.
cath, yeah, and our digital angiography over there. Yeah, it's 1987, in fact.
See, it's interesting because this feels like yesterday to me. I still feel like I'm part of that time, and it was a long time ago.
Yeah, but my hair's gotten grayer.
No, well, we won't talk about what I do with my hair today.
No,
so.
we won't.
The concept of digital photography is really popular now. I mean, there's dozens of different brands of digital cameras that we play with. I play with them and say at my home computer at night. And I never really even thought they would be doing digital x-rays. You know, like you think of the x-ray film. So now that's what you've got here, digital x-rays. Maybe you could explain how that works.
I'd love to. This is the heart and the crutch of the whole system right here. This is it's a Fuji 5000 system, and then what it is, it looks like a regular. Our cassettes look like a regular cassette, but what happens is when we put this cassette in, the digitizer reader will open it up and pull out a small screen right here, scans it, and then it'll show the digitized image up here on the board on this little monitor for our techs. And then after they see it, that if they like it, they'll hit a button and they'll transfer it over here for they do what they do. It's called their QA, it's quality assurance. Right. And then when they're happy with it, they will send it to the radiologist who will read it on the monitor in their reading room. Or we can also print it over here. We have what's called a laser printer that we can print the images on. So if we have to send them out to a doctor outside the area.
Well, again, I see these fantastic pieces of equipment, many of which I'd like to have at my own home, but I don't think I have room for it all. What's going on here with these things? What is
I don't
it?
think you have the money either,
Right.
but
That's right.
we're in our CT and MRI department of imaging here. These are both GE Lightspeed scanner and the GE MRI, which is directly behind me here.
These are state-of-the-art scanners that can do what kinds of things?
The CT, we can do all types of our normal CT imaging, backs, heads, necks, abdomens, the pelvis. We're even doing some what's called CT angio. We're seeing the vessels, mainly used in the neck and carotid area. And then in the MRI we're doing more soft tissue examinations, again, of the head, the neck, the abdomens, the backs, looking for tumors. Again, we can also do what's called MRA, which is magnetic resonance angiography. It's a less interventional procedure that the patient can go through that doesn't include putting a catheter in. We get a pretty good diagnostic tool with it as demonstrating the arteries of the bodies.
How long does a brain scan take?
A brain scan without contrast is probably about 5 minutes.
5 minutes, that's quite a
with
breakthrough.
contrast, it runs maybe 15 at the very most. The scanning time has cut down considerably from 20 years ago when it took half hour to do maybe 15 slices, where we're doing 6 slices a second now. Plus with the new computers and processing time being cut down, it's almost instantaneous.
And then this, like a lot of your other digital equipment, the images go right onto computer?
Right.
Now, this equipment seems to get more and more modern, of course expensive and faster and things. What are you planning, let's say 2 years from now something new comes out and you've got this 2-ton machine sitting there and you decide you don't want to get rid of it because it's still state-of-the-art. What are you going to do next?
Well, fortunately with Sutter North, we've planned for the future. We have another room that's adjacent to our department, which is probably about 30 by 40. It's a good-sized room it's called our future technology room. That in the future, if we want to add maybe an open MRI, we can do that. Or maybe some more nuclear medicine or another modality that comes along that we'd like to have. We have that capability. We have the room. We don't have to do any more knocking out walls or a lot of remodeling.
Well, I have to tell you, a very impressive facility you have here. Fantastic equipment. Hopefully I don't need to use it in the near future, but I would certainly consider it if I needed to, that's for sure.
Well, Sutter North is leading the community right now in imaging, and we want to be the imaging choice of the community. And I'd like to thank you, Dr. Peppercorn, and your people for coming and visiting us.
Pleasure, thank you.
You're welcome.
Great. I wasn't aware that you had a complete cardiac rehabilitation service here, so that means if someone's had a heart attack and they then need help after to get back in shape, you do those things, is that right?
Absolutely. We cover actually 4 diagnoses if a patient has chronic angina, which is chronic chest pain, or if they've had a heart attack within the last year, or if they've undergone a stent or an angioplasty. They're welcome to come into our program. They're referred by their physician, and this is an exercise and education program. So they come, it's a 12-week program, 36 sessions, and they're here for an hour 3 times a week for exercise, and they're monitored on telemetry so we can watch their heart rate and rhythm. And we're checking their blood pressures, and we're asking about their exertion, their RPE, or ratings of perceived exertion.
Sure. So as they're in here, you're giving them basically some lectures, information about diet. You have I see a registered dietitian coming to give a lecture here. You have all the machinery like a health club.
Absolutely.
So can I sign up for health club activities too?
We have state-of-the-art equipment. Yes.
And then for safety, you're monitoring their heart on the computer monitors.
Yeah, so we're watching. We have the capability to watch 8 patients at one time on the screen, watching their heart rate and rhythm at that point. And our registered nurse usually is the one that monitors that during exercise.
So it would be mostly cardiologists and general physicians, internists referring their patients over here from the hospital?
Yes, absolutely.
Great, fascinating. This lab is beautiful. I mean, it looks like the fanciest university lab you'd see where people study chemistry.
It is. It's truly gorgeous. We are really excited about moving into this new facility. We have windows, and the med techs are really excited about that.
Yes. Now you have a machine here I've never seen before. What is this doing?
This is our chemistry analyzer. It's a Boehringer Mannheim 911, and it does all of our chemistry panels. It runs about 60 panels per hour. It's a random access machine. As you can see, it's randomly picking up the specimens. All the specimens are bar-coded, and that's where we get most of our panels.
So that would be things like the calcium, potassium, sodium, and all those things are done right in this machine here?
That's correct. We also do T3s, T4s, and digoxins on this instrument.
Right here?
Also. Yes.
Would that be things like cholesterol
Yes.
and triglyceride and
Absolutely.
liver function testing?
Absolutely.
All with this?
Yes. All with this one analyzer.
Well, there's another machine I'd like to have. I probably can't afford it, but it would be a nice one to have. And you have other machines here that would do things like blood counts and all of those too. Where would that be in this?
Yes, we do. They're back in the back. We have a Celldyne 3500, And we also have an instrument called an Emulite that does all of our FSH, prolactin, TSH, PSAs, testosterone, H. pylori's, things like that, the immunochemistries.
What's important for patients to see, besides the fact of how modern and nice this is that there's very little chance for error here, because the specimens aren't moving from one place to another, to another, to another, with having to be shifted between one person's hand and another person's hand. It's all loaded in here, labeled, and done.
That's correct. We have a lot of control over our specimens.
Well, thank you very much for showing us.
Thank you very much,
Very
Dr.
nice. Thank
Peppercorn.
you. Again, I'd like to thank the physicians and staff of Sutter North for allowing the Medical Explorer to visit this wonderful new healthcare facility in Yuba City. We look forward to learning more about other healthcare services that Sutter now has on their drawing boards on future Medical Explorer programs. Well, that's our program for tonight. I'd like to invite you to write to me at my dermatology, cosmetic laser surgery, liposuction, and allergy office in Yuba City with your suggestions for areas and people that you'd like to see on this program. I'm always interested in hearing from you, and I hope that you'll suggest to your medical doctor or other healthcare professional that you'd like to see them here with me on the Medical Explorer. As you know, we are a public service program, and I really do want to hear from you with your comments and suggestions. Please feel free to write to me here at the Advanced Dermatology and Laser Center at 350 Del Norte Avenue, Yuba City 95991. Or you can always check out our new updated webpage with your computer on the internet. Simply key in www.bestlasers.com and check us out on your computer. In my next program, The Medical Explorer will take you behind the scenes of more interesting frontiers of medical care practices in the Yuba City, Marysville, and other Northern California areas. For all of us here on The Medical Explorer, I'm Dr. Robert Peppercorn. Thank you for joining us tonight, and have a great evening.